Committee, Godfrey Kiwanda Subi, promised to address the matter, as we see in this report.
Quarantine centers protect persons who may have been in contact with the COVID-19 victims or have traveled from one of the areas with high transmission of COVID-19. They are required to start a facility for the mandatory period of 14 days. 40-year-old Stephen is a resident of Oburu Zone, Kalachai Parish in Tororo, has spent 5 days in the quarantine at Mukujukowa Primary Teachers College in Tororo. He was picked from a bar by local authorities as one of the contacts of a truck driver who had tested positive.
I'm very happy to see how I stay here. Those ones at home shouldn't be afraid because we are not sick. Let my family be patient. I'll be back after 14 days.
Evelyn Achom, aged 38, is also in the same quarantine.
They do wash before they give us and sanitize it. Okay. Where we also select it's a clean environment. The rooms are clean.
This center accommodates 98 contacts. Returnees from Kenya are among those visited by the chairperson of the COVID-19 subcommittee on non-medical logistics, Godfrey Kiwanda Subi.
Since this was an emergency, we had 200 liters an emergency, but now government has come in and they are supporting us with the basic utilities.
Kiwanda also visited Busia's quarantine center at Daban Girls Secondary School with 82 contacts, both Ugandans and Kenyans.
So the Ugandan males are 41, Ugandan females are 26, then the children are 9, those are Ugandans. Then Kenyan side, we have 2 males, 3 females, and 1 child, so totaling to 82. Okay. Every morning we have a health education session with these people where we talk about all those things, including relationships while they are here. We discourage them because we told them what brought them here was linked to corona. We don't want to live with this place with the syphilis, pregnancy, and other STIs.
Busia District Health Inspector Abdallah Namahanga told UBC that transport remains a problem.
Of these suspects who have finished the mandatory days here, taking them back to their homes, because we are supposed to escort them to their homes and give social support to their families and the neighboring people.
Minister Kiwanda urged those in the quarantine to be disciplined.
The government is not putting you in the quarantine because we want to mistreat you. No. It is a requirement that your families at home remain safe. Some of you left your judges at home and you want to rejoin the families. So we are doing this to see that by the time you go back home, you're okay and you cannot transmit this disease.
This was the same message carried to Namisindwa Quarantine Center at St. John's College Magale, where 98 people, most of them returnees from Kenya, are being kept. According to the Minister of Health, the number of COVID-19 cases in Uganda now stands at 260. After 12 new cases, all Ugandans were confirmed from the 1,743 samples of truck drivers. Bernard Higa, UBC TV, Busia.
Uganda manufacturers are pleased